So again, good afternoon or good evening to everyone. So we will continue our discussion for the week 4. Our learning objectives for this afternoon is related on how you will distinguish the various services and direction related to the National E-Health Program. Uh, we can explore the concept on how the national e-health had been conceptualized and established its framework so that it's one of the priority agenda of the Department of Health. So when it comes to the nursing informatics, national e-health nowadays is very significant when it comes to the implementation of the processes in most of our healthcare facilities, even if it's in a primary setup, in a secondary to tertiary, until to the specialty healthcare institutions. So now we will discuss about health information and management systems. As part of our learning outcomes, we may encounter various platforms that are being used by the various facilities from the primary care up to the tertiary hospitals or specialty institutions. And eHealth Philippines had been introduced so that to consider that management system is very important as part of the trend, and at the same time as part of how the these facilities will have efficient operations. So it was defined by the Department of Health. We have the so-called HIMSS. So we have the Health Information and Management Systems Society, wherein the HIMSS here in the country started on how the use of the internet and technologies will basically improve four aspects. Okay, we have we have the internet, we have the technology, and the technology that we are talking about is uh it's either the hardware or the software, the various platforms, and usually the e-health is focused on the healthcare industry. Although this may cover also, or this may consider also some of the processes that may consider as part of the business operation as an identity. So a hospital is considered as a business because it may need also financial stability to continue its operation. So it may depend on what healthcare facility we're talking about, because there are some government institutions that are funded by the local government units or by the national funding. But however, the difference with the private institutions, usually they depend on the financial capabilities on how they could sustain these operations. So in this situation, as what I have mentioned, the health information and management system utilize the application of the internet and the related technologies. This is to improve the four, as what I have mentioned: the access, the efficiency, the effectiveness, and quality of clinical. So if we say access, the access may also correlate with the time, because it is very important for every healthcare practitioner to have an access to the information or needed information, so that it may also have a very timely response to emergency situation, a very an appropriate response when it comes to the status of the client, that will not ask any more interview of the client, but may access information based from the past medical history of the client, or even previous hospitalization. The access is very important, in which, for example, in one institution, the use of the hospital information system, or HIS, is very much significant in a hospital operation, because if the healthcare team wish to access the information, they may not anymore have the physical gathering, but rather they could use the platform to access the information, so that they could already plan for the care management of the client. And this may also have the exchange of information among those healthcare team members. So this is what we call access. So even though when it comes to the accessibility, not all may have the privilege to access the information simply because of the what we call Data Privacy Act. I know in your laboratory, one of the topics that had been considered is all about the Data Privacy Act. What are the rights of the subjects, and how to consider protection of information by the same by the data subjects. So another is if we consider efficiency. So what's the difference between the efficiency and effectiveness? Anytime, every time, sorry, every time that you will encounter the term efficiency, it's all about, always bear in mind about letter R, resources. So when it comes to to consider efficiency on the use of the technology and the internet, efficiency is to maximize available resources in the particular facility. Do we have different setup or available resources in a primary care compared to the secondary and the tertiary? The answer is yes, because that made these facilities different from each other, the resources. But this may not be a hindrance for the healthcare practitioners or healthcare workers to access information because of such limitations and resources. This could be funded. This could be supported by the local government units if this is one of their priority agenda. The funding itself, as part of the being efficient, may consider also on a perspective like for some hospitals that they cannot facilitate to subscribe a specific hospital information system platform, because again it will allocate a cost when it comes to the subscription, and at the same time when it comes to the maintenance of the platform. So how it becomes sustainable? So you need to be efficient and you need to have funding. So another is to have an efficient implementation of the health informatics or health management system in a facility is we are expecting that the manpower, the employees who are working in these facilities are skilled and competent. But how they could be skilled and competent? We need to have an expert. So again, that is being efficient. We need an expert to teach to teach the employees, the nurses, the healthcare team on how to process the use, on how to facilitate the use of the hospital rather information system. So that is what we call efficiency. Another is effectiveness. Effectiveness are considered as the outcomes. If you are efficient, then it will lead to the direction of being effective. And usually we focus on the measures of effectiveness related to quantity and quality. So that's why every institution has the vision, has the mission, simply because it may project the direction of the hospital. If, for example, if the hospital wants to be the premier hospital in the city or in the locality, then it must start with being efficient, because it must upgrade the system. It must upgrade also the skills of the healthcare manpower or the workforce. So that is important as according to HIMSS. So another is quality. Since most of the healthcare facilities, the stakeholders that are being considered are the clients. So that's why quality of clinical, di ba, when we discussed before about yung related sa clinical, it's more on individual approach. So that's why stakeholder focus tayo or client focus tayo. So other than this four, to have access, to be efficient, to be effective, and to have quality of clinical, the business processes itself also may be relevant when it comes to the operations. Just like, for example, the the client can already access for the billing statement using a platform. The client may not anymore proceed to the billing section or to the finance department. So she can be updated in real time when it comes to the access to the platform. Another is whenever the nurse will request supplies that will be needed for a specific procedure in the ward, so she may not need anymore to proceed in the central supply room. rather than the nurse can already access if there are sufficient stocks of the supplies that she may need to in the specific procedure. So that's why the stakeholders that we are considering, the beneficiaries, if we will consider the health information and management systems, are our stakeholders. And these are healthcare organizations, practitioners, the patients themselves, and the consumers. The patients could be a well patient or sick patient, and moreover, the direction is to improve the health status of patients. Kaya with the use of the health management and the health information as well, and with the informatics embedded to it, it will improve. It will really improve how information can be accessible and can anytime support your evidence-based practice or clinical decision making. So there are some challenges of today's health system. Although this was way back years ago, but still at present we can still associate this to these challenges. We all know that the universal healthcare had been enacted into law already, but there are still challenges when it comes to today's health system. Access to healthcare services. Okay, when it comes to the healthcare services, we are aware and you have been oriented in your community health nursing or CHN that there are primary healthcare services that are being offered in a setup such as health center. So, but not all of the services are available in all health centers. That's why even before, they have considered also health stations to be established in most of the government or public schools, but it was not it did not lead it and material it did not lead it to its operation and materialize simply because again of funding. So it may depend on the individuals who will be in the position if it will continue the endeavor. So based from some of the documentaries, there are facilities that have been made but it was not used for operations. So the healthcare services that we're talking about is here in Metro Manila. We can appreciate the healthcare services available because most of the hospitals and our health centers are upgraded when it comes to the resources and facilities. But going into the regions, specifically on the mountainous areas, the healthcare services may not be available at all times. There could be scheduled of the services that could be available on a specific day only because they may lack manpower and they may lack resources. So we will try to implement the health informatics or the health management system to these areas. This may still be considered as challenge. However, this must support the universal health care. So hoping the government will support the funding because it's already into law, the Universal Health Care Law or Act. Another is the challenges is access to real-time information for decision making. Yon. So yung most of the typical example that I mentioned to you is, for example, there are clients who have been in the facility, but the initial prenatal consultation was done in Mindanao, but she is in Metro Manila. So and it's already emergency. The client is high risk. So the client may not cooperate and might not have all the resources that she may have to supplement all the information needed um, by the healthcare team. And it may take time. It will really take time for the healthcare team to gather basic information because within the, for example, within the 9 months of the pregnancy and 3 trimesters as well, to what extent that the client had regular consultation and what are the results of the recent diagnostic examination of the client, which will be the basis of the healthcare team to manage the high risk pregnant mother. So if the hospital itself may be given the right or access right to the facilities where she had consulted, then this could provide a real-time information. But it's not the reality that we are experiencing. Another concern is there are some situations that we have the platform, but the internet connectivity is not established in those areas. So I think this must be one of the priorities of the government. I know these are in progress, but hoping this system, health system, when it gearing towards health informatics, must be one of the highest priority, because the e-health is the one that has been the solution to hurdle those challenges in the universal healthcare or kalusudang pangkalahatan. And can you imagine that it is based from the Universal Healthcare Act, that every facility or healthcare center, there must be one nurse. And even though there will be one nurse, but the assigned nurse from one health center from to the other may be efficient when it comes to the information if we have an established platform. Before, we have the RX box. The RX box was established in the University of the Philippines as to the intention for anyone who may be given the rights to access, be given the rights to have an access on the information, so that it may have the real-time information for the decision making. But still, up to the present, these are considered as challenge. Actually, it was in 2020. If we go back in 2020, the National E-Health Vision in 2020, this is, even though it's 2020, but hoping, and I know that they have already crafted the 2021 onwards for the next 5 years. But looking back as a realization that this was the vision 2020, if it started 2014, 2015, so it was 5 years. Do we already achieve the vision? So let's see. The National eHealth Vision is to, first, is widespread access to healthcare services. Is it widespread access? Not all hospitals. Okay, not all hospitals. Usually, private hospitals are the ones that really took risk of having the hospital information system. But when it comes to the government institutions, there are district hospitals and local government hospitals that are not yet engaged into the use of the hospital information system. So that's why some of their processes are manual or the traditional. If for example, if the nurse will do the charting, it's the written charting, while the other hospitals, the premier hospitals, are doing the entry of the charting through the use of the hospital information system. And that may obviously have the difference when it comes to the access to information and access to healthcare services. So we can actually have the a realization na why there are some hospitals na some of them may have delay healthcare services. It's because there are some coordinations that may need response of the primary healthcare if the patient was transferred to a secondary or a tertiary institution. So that's why even during the time of COVID-19, di ba, individuals cannot be admitted immediately in a hospital without the referral of the local government units or the rural health units. So if this has not been established, we cannot say that it's in a widespread access, because we have observed that most of the problems that clients address are the problems when it comes to the long wait that they are experiencing while having the decision, or while having the solution that is supposedly on emergency situations, or supposedly a very timely response by healthcare team. So widespread access to healthcare services. So let us have the realization, a widespread access to health information. So based from the examples that I have emphasized, that it is not the vision that we are experiencing now. The vision that is supposedly the widespread access for health information may not just be on the national level, but it could be on a global or international level. That's why, if for example the client had her prenatal checkup in the US, and then she decided to have her delivery here in the Philippines. So there are still clients who still need to bring all of the papers, all of the papers, diagnostic examinations, medical abstract, so that to support the information needed by the obstetrician here in the Philippines. So still, this is a concern, the widespread for the health information. How about the widespread access to secure and share and exchange patient information? We are aware that we have the Data Privacy Act and it's already a law, but on the extent that do information are secured. So we have heard news that there are many accounts that had been hacked, even social media accounts, bank accounts, and even patient information. So somehow it's very alarming that this is still happening, even though we have already the implementing rules and regulation of the Data Privacy Act. But I think there is a need to really focus if it is considered as a widespread security on the sharing and exchange of patients' information, on to what extent that it is secured, then probably there must be a study to facilitate that the access of information has a strict policy. And we all know that even in the National Bureau of Investigation with the NBA, they have encountered many problems or many issues and legal concerns related to this sharing of information. So even in the social media, they can track those individuals who are considered as dummy accounts. They can track also, di ba, if you can still remember the problem with the COMELEC, that the voters' information had been accessed. Another is for there are times in the social media that most of they have this fear that the social media accounts, specifically in the Facebook, had been hacked. Bank accounts in use are usually one of the problems and concerns that had been identified. Sometimes we have, most of the time, we have the mechanism on how to protect. We have the platforms on how to protect. We have been aware, but yung level of awareness and knowledge is one of the problem. Kasi there are some situations that we must also take into to focus yung preventive measures. But sometimes these are the things that we fail to consider. The security features of the platform are available, but the person who's using the platform is the one who's not aware and somehow not competent. So I think with the widespread access, with the by 2020, let us make some of the realization. So it was mentioned that the e-health, as other than to secure, is to support the safer quality healthcare, more equitable and responsive. Kasi if it is a timely, if we have the widespread access to health information, then we have a timely response to the health system. If we do have the widespread access to healthcare services, then it may lead to the more equitable health system for all Filipinos. So these are the things that may be considered as an outcomes. But again, let's go back. It's 2020 National e-health vision. We are already 2021, 2022. What happened to the 2 years? And in this was the time that we have encountered the pandemic, and supposedly this must be strengthened at this time, even in any aspects of our profession, from the nursing practice to public health to nursing education. This e-health are already embedded, and even students must definitely be exposed and be aware on how to maximize yung skills nila when it comes to the purpose of the e-health in the country. So actually, the purpose of the e-health is to have transformation on how the information was used. You have been aware of the data, the information, the knowledge, the wisdom, and the practice. That was the time that we have discussed it in the theory of information, or informatics theory. But the way that we need to consider on managing it is to plan, manage, deliver, and monitor health services. Uh, that's why in one of the informatics theory, we have mentioned that data can be processed to information, and information can be translated or transformed into a knowledge if it will undergo the management system or management processes. So the management processes that we're talking about is to plan, manage, deliver, and the monitor, or such as plan, organize, direct, and evaluate. So this may encompass the management system if we are already the widespread access to healthcare services and health information and security of information. So if we have that in 2020, and I think that is the time when the pandemic started in March. So hoping that in the 2 years after this health vision, we have already an established uh, and clear direction when it comes to the health informatics. Actually, when it comes to the health informatics, as mentioned, as the National E-Health Vision, these are the initiatives that the government have already in place. They have mentioned about the National E-Health Vision, and by 2020, that at least most of the hospitals may have the EMR already, yung electronic medical records. So with 1, 2, 3, 4, 5, the 5 and 6 on the direction on the eHealth vision, it all started with the PHIE, the Philippine Information Health Information Exchange, or PHIE. So why we have this established first before it lead to the National eHealth Vision? Because let us try to benchmark what is the existing practice when it comes to health information exchange. So uh, until present, we have observed that even in the vaccination sites, right? In the vaccination sites, even though you are using the laptops, but still you still need to undergo and bring the paper with you, to have the validation of the doctors while you are taking steps before receiving the vaccines. So if the Philippine Health Information Exchange have envisioned already that we could have the platform that you can already have uh, that you will enter the information needed for each data, so you will just proceed to the vaccination site and have the clearance already, while while when you visit those vaccination site, you could just only have the phase when you're about to have your vaccine. You may not anymore have your triage, although validation is still very important. But if the doctors may have the access to these platforms, the the that that the timing, the pacing could be more efficient as compared to the traditional way of doing it. So that's why it started with the Philippine Health Information Exchange. So yan yung these are the platforms that they have already started. Yung cheats, these are the platforms that are established in Quezon City health centers. iClinicsys are platforms that are also used in the provinces, in the health centers, for the access of information. So some may have the Shine OS, we have the iHomeis. So these are some of the platforms that the focus is mainly on the health data standard use. If you will notice yung arrow, it's rising, and that is the direction. So it started on the existing traditional through the use of the platform, and since the platform had been established, health data standard use. So health data standard meaning, di ba, at least everyone may have the common data that are embedded in these platforms. But since these platforms are different from the Quezon City use and from the province use, so probably there is some information that may not match. So I think there must be a universal platform that must be used, since we are already in the universal healthcare era. then we must already have this platforms that could be standardized. So that's why there must be the data that are only be needed whenever you will have your consultations, or whenever you will have your you wish to avail the healthcare services of these facilities. So the next is, if for example, if if a particular facility are using these platforms, at least these platforms may lead towards the EMR, or yung tinatawag nating electronic medical records. Yung certification is the facilities will be ocular, will have the visit for checking if the capabilities of the facility of the facilities are sufficient to support, if we could have the platform or the hospital information system. So if you are, kasi ano rin yan part of the ano rin yan, part to check also yung quality, kasi nga what of the most of the issues that we may consider is yung access, so yung protection, at the same time information may not leak, tapos there must be troubleshooting. So these are the things that may also consider yung readiness of the facility, not just only with the resources but also with the capabilities. Kung halimbawa naman we have the platforms pero the hospital facilities do not have an established internet connectivity, so it may be useless. So these are the things that may need to take into account. Another, since the government facilities, the public health facilities are the ones that are being funded by the government or the local government units. That's why during the time they have mentioned that they have envisioned IT in all public health facilities. Okay, so IT, information technology, in all public health facilities, from the health centers up to the hospitals, until if they have started with the electronic medical records, the higher level or the leap could be IT enabled health services. So pag na-establish na yung electronic medical records sa hospital, now the facility could have the upgraded services, if most of their services, not just only from the admission up to the hospitalization, but even diagnostic facilities nila, even the other health services are already IT enabled. Pag sinabi nating IT enabled, all these informations can be accessed in one platform upon the operation of that healthcare facility. From the health center, they can request access for information to the healthcare facilities, and on the other hand, vice versa, with the healthcare facility can have the access for information to the primary care facilities. So yung the highest level is IT enabled health services, and that is the one that is being considered in the national e-health vision. So let us think, are we there? Let's have realization. These are the things that the national e-health vision is gearing towards improvement of health information system in the country. Sa National e-Health Vision, they are considering health information, health records, healthcare services, and healthcare activities. Just like for health information, nowadays, we have the DOH HHRDB that's responsible for the statistics. If we ask about the causes of death, top leading causes of death, top leading causes of morbidity, top leading causes of injury in the country, male, female, children, age group. So this is what is lacking, because one of the geographical difference is that of from one island to another island. And the established network of internet connectivity is one of the challenge. Pero hoping, even though we have 7,600 islands, 600 plus islands, hoping we could have the real time. That's like the recent initiative that was made by the Department of Health, wherein they have considered the daily updates when it comes to the COVID-19 cases, and how they did that. It's through the use of the various platforms that's why one of the requirements for diagnostic accreditation or recognition of the DOH before is they do have the stability and capability when it comes to real-time information reporting. So, yun ang isa sa mga basic requirements. So, I think the health information could be helpful if this will facilitate specifically for example, if I can only visit the Department of Health, I can have an access of uh, the top leading causes of death as of today, but it's not the reality because of still some of the limitations on the concern. Another, for the national e-health vision, the health records are the ones that we're talking about, the electronic medical records or the e-health. Okay. So actually, when we wish to access about results on the personal records, medication record, medical history, examinations, and procedures, these are supposedly the vision that every healthcare team can access even outside the hospital, so that it could facilitate real-time decision-making or evidence-based decision-making. Even with the patients themselves, if they will have a consultation with another doctor and they will be asked about the recent results, but they do not have the physical printed results, they could if they could have the access on the health records on their own. So that is supposedly the mechanism now, that the client may have, or each one of us from these facilities may have the access to information, but still it's not happening. That's why we have I think the PSI, wherein we are asked to have our own ID, okay, personal ID. Probably this is the direction for us di ba, we are now using QR codes, and the QR codes could be identical to the patients or to individuals, so that they could easily have the the permission for these individuals to have access, kasi that could be a form of validation eh. Kaya nga ang QR code, uh, the one who can have the access, the person who have it. So ang QR code kasi, it cannot be barcode could be other than the QR code. Pero for now, these are being used by some of the hospital facilities. And even in our own mobile phones, we have the QR code reader already, the barcode reader already, and we can have we can have our own QR code. So let's see on what could be the direction on this matter, even though these are already in place and established. So just like with the healthcare activities, if we do have the implementation of the national e-health vision, supposedly we could be on a real time updated. For example, if nowadays we do have already mga mobile healthcare services eh. So we can track even in a mobile application that if we have the mobile clinic that already visit your town, you can access that through the tracking device. So but I think try to think in the future, nurses, if this could be part of your research, if you're thinking of a research, one of the greatest milestone that you may have, if you will think of some of the applications that will really help our stakeholders, our clients, for the efficient and effective use of these resources as well. We do have the laptop, we have the mobile phones. Ang mobile phones are very handy eh. So that's why you may concentrate on the health, wherein the applications can be available already in the Google Play Store, and they can just only have it downloaded. So another, for the healthcare services, just like if you wish to access to diagnostic results, or you had been in the diagnostic center, you may not need anymore go back to the facility to have the result, but you can access already to the hospital information system. You will just be given a password. So diagnostic exams, even pharmacy services, these are the problems. These are some problems that some of our stakeholders are experiencing even during the time of pandemic. They are searching for the availability of drugs, mga antiviral drugs that are being used for the management of COVID-19, that they do have they did experience hard time when it comes to the access of what hospital, what healthcare facilities where they can access the stock and supply of the drug of the mentioned drug. So very typical use of mobile phone, just a call, but if you can already access the healthcare facilities which has the real time data, which has the real time statistics of available facilities that has the supply of such drugs, then it will be easy for us to decide and have it access. So as mentioned in the national e-health, if this will be in place in one perspective, we have a safer, quality healthcare, equitable, and responsive health system. So, yan naman yung focus natin eh. Pero, can you imagine, historically lang ha, by historical, can you imagine that it started the development plan 2011 pa lang. Tapos they have 2011, they 5 years. 5 years of their vision. During that time, in the Philippine Development Plan, yung e-health context setting is we do have pa lang the Millennium Development Goals. And ngayon, we have the Sustainable Development Goals na or SDGs. So what happens from the 2011 to 2016? So there are many factors to consider. What are the factors to consider? Kasi if the change in the government leadership or administration, if this may not continue or may not be a priority agenda, this may not be funded. So it may not continue and have it sustained. So even they do have the national objectives for health in 2011 and 2016, uh, it started yung conceptualization with the Millennium Development Goals and the World Health Organization until after 2016 or in the middle of 2011 to 2016, they have already this Philippine e-government master plan yung 2013 to 2016 kasi they need to consider na yung health enterprise architecture. If you say architecture, it is on how to see the picture so that these processes can be improved, yung health information system can be improved. So they have even conceptualized the Philippine digital strategy of 2011 to 2016. This is the time that they have already established yung mga internet connectivity, tapos mobile communication services. So ina-upgrade nila 'yan. If you will notice from this year, nagbabago ang model ng mobile phones kasi nga this is one of the direction even with the upgrading of the laptops wherein it could be compatible with the platforms. That's one of the plans supposedly of the Philippine digital strategy of 2011 to 2016. And between the 2011 to 2013, this is where the information system and strategic plan of 2011 was established until it becomes Philippine e-health strategic framework of 2013 to 2017. So yung recent noon ay 2013 to 2017, but I think this must be, since we are now outside na of the national e-health of the 2020. These are the things sana that the framework is planning. Yung services, yung PHIS, yung Philippine Health Information System, kanina 'di ba Philippine Health Information Exchange or PHIE, ngayon naman is Philippine Health Information System. These are the 1, 2, 4, 6, 8, 10, 12 areas. 12 areas wherein they have considered yung Philippine e-health strategic framework, that all of these services will be will focus na on health information system or e-health. Frontline services, yung mga frontline services, if for example emergency room. So yung mga emergency services that they could access, regulations when the client wish to access of what is the basic policy when it comes to the admission policies and hospitalization policies of the institution. So sana it could just only be accessed. Pharmacy services of the available medicines or drugs, over-the-counter drugs. Community-based services, if the basic storage of information of the clients can be stored in a platform in a health center. Disease registries, ito yung mga surveillance. Pag sinabi natin surveillance, yung tracking, yung statistics, number of cases, yan. PhilHealth, this is related to the health, finance, and insurance, wherein before, di ba, most of the individuals may still proceed to the PhilHealth offices just to process application and just to have their payments, their dues for the PhilHealth. But nowadays it could be it can be accessed through online, even from the application up to the payment. Other the emergency response. So ito naman yung whenever there are disasters, we could already identify supposedly the team or the team that is close to the areas that may respond immediately. So yan yun. I think there could be instances that you will be invited, or the laboratory group, our NCM 110 group, will invite the Philippine Red Cross for you to be oriented on their system, on how they could identify yung registries ng kanilang emergency response team. So health supply chain. So yung sa health supply chain, these are very relevant when it comes to the vaccine, di ba? Yung vaccine, yung pag-transfer ng vaccine from the other areas, if we have sufficient resources to facilitate. Kaya that's why before there are only few areas who can only be given Pfizer because of the requirement and the resources needed. Health service delivery. So we are aware of the primary healthcare services. So hoping if an individual can access, if this is available in that facility. So madali yun, so that each individual can have an option. Kung hindi available in that community or in our own community, then they could have an option to look for other facilities. So another, diagnostic services. So this could facilitate the information exchange of results of diagnostic examination. Environmental monitoring, if nowadays we have a problem with the climate change, it can associate its effect to the health. So that's why in the environmental monitoring, it can facilitate yung ngayon sa mga mobile gadgets, na sa mga mobile phones natin, we can identify environmental temperature, we can identify the steps that it will count for the walk that you have done in a day. So another is human resources in health. So this may identify how many nurses are available in your communities where to whom you can seek help. So can you imagine the supposedly 12 services na we expected sana na these are already web-based. This could be already applicable on e-health or m-health. So that's why it's 2020, and we can imagine yung perspective na yon. And this was already cascaded in the 66th World Health Assembly, that this roadmap is already a must because it was a direction. This was all this was a pre-pandemic roadmap pa, and we are not expecting that this may direct to this era of the new normal. Before the fourth industrial revolution, we are not too serious about it, na we can just work at home, we can have our school at home. We had not envisioned that, but due to the situation, this will consider na yung embracing these changes. And even before, in the 66th World Health Assembly, it was already a vision that linked to the national e-health strategy, because somehow remote services can be done and access to information is the highest priority. So that's why it has this Philippines e-health strategic framework and plan, or yung tinatawag nating PHSFP, which ang purpose of the Philippines e-health strategic framework and plan is this is the result of what are the needs of the country when it comes to the health goals and challenges. Lalo na ngayon, we do have the universal health care, and it is very significant for us to identify how the people can respond to the needs. So very timely. It's very timely in our future direction. It is very timely that we must take it seriously. So that's why with those principles, we have discussed before yung clinical informatics na client focus, tapos interprofessional collaboration wherein all the healthcare team members can have access to information, users involvement, the stakeholders involvement kasi whenever we have the telehealth, how the users can be actively participating when it comes to telehealth, which is now happening yung teleconsultation. So that's why even though we can now have our consultations in hospitals, nagiging option na ang telehealth, ang teleconsultation because it was already a part of the practice. So yung strategic approach in paces na unlike before we have long pace, but now a shorter pace can do because of this e-health. And usually yung harmonization and independence, yung level of independence, for example, a client wish to may not anymore ask the healthcare practitioners, but through the access of information, we can have high level of independence for him to access the information on how to prevent diseases, on how to manage emergency situations. Yun. So the e-health also may also strategize when it comes to the available human resources in the community. What are the existing laws? Kasi let's face it, in the 2 years from MECQ, now alert level 1, 2, 3, 4, 5. So can you imagine those changes in the laws and regulation? But sometimes we have not watched news on the television, but all we can do is to have the access on a specific web-based links or references for us to be updated. So if this e-health strategy will do, then that could be significant. So if you will notice, eto na po yung supposedly framework na actually I know that this has been adopted. Okay? This is still adopted by the country on how it will still really consider po yung Philippine e-health components. So ano po yung mga Philippine e-health components? Actually, there are four major Philippine e-health components. Governance, second is legislation, policy, and compliance. Next is yung e-health solutions, tapos yung standards interoperability. We have discussed about kung ano yung tinatawag nating standards interoperability. Pag sinabi nating standards interoperability, it's already yung exchange of information. So we will discuss one by one per group so that you could be enlightened and not be overwhelmed with information. So mag-start tayo with governance. Usually, pag leadership, governance, and multi-sector engagement, pag sinabi nating multi-sector engagement, this is the key term. Pag sinabi nating ito yung governance, it's more on the e-health goals. It's more on the strategies that will cater all levels, from the barangay, local government, district, until it becomes in the provincial level. So that's why most of the governance that you will see in the slide are more on the following: management of the e-health agenda. So we are aware of the e-health agenda, on what is the purpose of adopting and embracing the health informatics. Operations management. So sa hospital, it can have efficiency of the hospital operation or the rural health centers operation. Monitoring and evaluation, we can have the specific surveillance and monitoring through the access of the information. Policy oversight, if you are still bounded with your decisions on the existing policies. Network and collaboration, I think that's why there is a management that may need co-management. For example, if you are a cardiologist and your client is pediatrics, so you will look for a pediatric specialist on cardio. So that could be use of the network itself as part of the governance. Yung strategic architecture, this is on how to use specifically yung resources at yung clinical safety, the highest priority. Pag sinabi natin clinical safety, it's the patient safety as the highest priority. So that's why when we talk about governance, it talks about e-health goals, strategies and activities that will reach all levels, from health facilities up to the decision makers until it becomes the part of the system. Now, number 2 naman is legislation, policy, and compliance. So, ang e-health sana can be used as a concept so that this will cascade as national policies and protocols. That's why if you will imagine, if you can recall that even the government already engage us to register in the staysafe.ph. It's because of the purpose of the contact tracing. So that's why in the legislation, policy, and compliance, if we say policies, the IATF, even the IATF may depend on these components of legislation, policies, and compliance. That's why when the IATF was established, when it comes to the national health protocols, these are managed accordingly with these areas, yung laws and policies that are existing. Kaya that's why sabi natin, di ba, if you are confirmed with COVID-19, you cannot declare it because it's data privacy. Pero there is another law pala, or an act that you need to have the declaration of your condition that may compromise the public. So it's a mandate pala and it's part of the law. So that is contradictory to Data Privacy Act. If not contradictory, but it supports if the public is at risk, and that's part of the national health identifier, because this national policies, the e-health component itself of legislation and policy, could be supporting on how it will have the prevention and even implementation of the OH policies. So health data standards or interoperability, yung exchange of information. At meron tayong mga software certification. Yung software certification is, that's why if you will notice, yung sabi natin, yung mga Department of Health are given accreditation and recognition because they are the only ones who can access to the platform for reporting to the Department of Health when it comes to the number of cases. And that certainly needs part of the e-health policy. Next, how about the standards and interoperability? Ayan, pag sinabi nating interoperability, yung exchange, di ba? And this considers yung terminologies, messaging, software certification, research and development. Usually, ito yung mga standards and interoperability pag sinabi nating RX. So, aware tayo through the use of the e-health, it's all about prescription. That's why we are now using the e-prescription. So, it is now widely used. So that's why this is the standards and interoperability is more on the consistent and accurate collection of exchange of health information across the region, across the districts, across the provinces, and even international. So nowadays we can have the telehealth na nga using the messenger. Through these platforms, we can have exchange of messages lang through text messaging. So we can already do this. But however, sometimes if the layman are not aware of some of the terminologies, sometimes we may have those misunderstanding. But the most of the terms that we are used, that's why it's already considered as standards and interoperability. You may only use terms that could be consistent and accurate and and everyone can relate to. Okay, number 4, the e-health solutions. This is the one that is considered as core system. Core system of services and applications. Why? Kasi almost all of the services that we expect that could be part of the solutions are very important. Kanina, di ba, minention natin yung, we have discussed the 12 services na aim to have the web applications. Dito na papasok yun kasi these are the core systems, just like information sources. Where can we retrieve information? What are the web sources, legitimate web sources? So even yung from sabi ko sa inyo kanina, yung one of the services that they could access is from the primary to the secondary, they can have the access. So that's information sources. Yung delivery of services, yung mga electronic, yan, that's why we have the e-commerce na nga ngayon wherein you can even the pharmacy could be, meron tayong e-pharmacy wherein Medications can be delivered in your own homes. Supplies can be delivered in your own homes, and any related health services. Even the testing, we can have the home service na. So individuals may not anymore leave their own homes at their convenience. They could avail these services already. So yan yung sa delivery and services. Sa information flows, these are on the perspective yung information exchange. At eto na yung sa human resources. Yung sa human resources, this is on how individuals will be trained and be aware. So that's why ito yung core systems, from human to other resources, from services. These are the e-health solutions that we're talking about. Pag sinabi naman nating infrastructure, we cannot facilitate, we cannot consider the e-health without the infrastructure, kasi yung infrastructure dito papasok yung terms as operationalization of the health information exchange. Kung walang connectivity, then I cannot facilitate this online classes that I may have now. If we are considering the teleconsultations without connectivity, then we cannot do it. If when it comes to these standards, operationalization is very important, and infrastructure is very important. Connectivity, the gadgets are important. So this is on how it will facilitate its maximization of resources. 6, the human resources. E-health is very important. So it is simply more on the workforce or manpower. Experts are very important. That's why we have the informaticists, the chief nursing information officer who leads the team when it comes to the information exchange and platforms that are being facilitated in every facility. The workforce or manpower is very important. That's why in a national e-health environment, everyone must be attuned with what is going on in a facility. So that's why orientation is very important. The level of skills must be upgraded with everyone. So although some may have restrictions because they are not open to the technology, but I know for a fact, even during the time of the transition, nowadays, most of the elders are the ones who are more engaged now into gadgets and simply in various social media platforms. So this could be one way that since they have been engaged into these platforms, then I think this could embrace the e-health components. The number 7 is the strategy and investment. So pag sinabi natin strategy, the keyword is sustain. How this could be sustained? Then it may need funding. So that's why it is included there, the financing, the fund management. So hoping this could be a priority of our government, and hoping this in these times we need to take into consideration that hoping the national government and the Department of Health will have this a priority, kasi we are now in the new normal and we cannot anymore have the maximum. We can still have the minimum public health standards. So these were just only the phases on how it strategized yung it started with phase 1 of 2013, 2015, 2016 it was transformed, and supposedly in 2020 it must be sustained and maintained, but we still encounter some of the challenges. And if we gear towards the e-health plan, it started with the 2011, and supposedly the 2020 is already the maintenance. But again, because of the circumstances which is not controlled, one of which is funding, then that's one of the challenges. So these were the action lines that were mentioned, yung governance, the e-health solutions, the change adoptions. This was mapped, and this was already mentioned in the di ba? This was already mentioned in the e-health plans, from governance, infrastructure, e-health solutions, and human resource. But hoping in the next years of the continuation of these plans and vision, this could be adopted. So I think we ended up with our topic, and hoping this topics that we discussed today are definitely very important for you to embrace, specifically the national e-health vision. So I think we have finished the topic, and supposedly we will have our health break. So we will just maximize our asynchronous session. I will just give instructions if the self-assessment exercise is already available in our Neo LMS. So I think it will end up this early, our discussion, our synchronous session for today. So any questions? So any questions from the group? Any questions from the group?